Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County with another of our Facebook Live updates. As always, wearing a new mask. This is a mask my wife made. It's made from the material that they make scrubs out of, which is a tightly wound cotton. It's really one of my favorite masks. It's also got one of these strap things on it so I can adjust it, so it's great. Anyway, I'm socially distant, so I'm going to take it down. Well, there's a lot to talk about tonight, but this is a chance for you to ask questions and for me to give you the best advice that I know. There are going to be some questions I think about our president, and I will try as best I can, yet I will tell you, I know nothing. I know a little more than you do. So as always, we start at the top and then move down. Still a very active pandemic. We're at about 35 million cases. 35 million cases and over 1 million deaths. Still a very active pandemic. You know, we had never hit as a world 300,000 cases until the 4th of September, and now we've had 11 days in September with over 300,000 cases. So rather than starting to come down and taper in August and September, which we thought it was, it's really continuing to go up. And still the world positivity rate is high. So it's not like this is just because we're finding a lot more cases. Still very high. Still very active in India, the US, and Brazil, but strikingly active in South America, especially Peru and Chile. So Peru and Chile have the highest, among the highest case attack rates in the world. These are, moderately affluent countries, and yet they've had a terrible time with lots of cases and lots of deaths. France has lots of deaths, lots of cases, but not very many deaths. And Israel really had a peak over the last couple of weeks, and they're just starting to come down now, a week and a half or so into a lockdown. But still a lot of cases. I mean, you think of Israel about twice the size of the US, having 5,000, twice the size of Oregon, having 5,000 cases in a day. That would be stunning. You know, when we get 300 cases a day, it takes our breath away. You know, if we had 2,500 cases a day, I'm not sure what we would do. And deaths in Israel are still continuing to rise. In the US, we're about 7.5 million cases, 212,000 deaths. There are 18 states with over 1,000 cases a day. I think once you hit 1,000 cases a day of anything in a state, it's kind of out of control. When you think of when, there's a big salmonella outbreak, we're talking about 65 cases around the country. This is 18 states each with over 1,000 cases, a lot of cases. In Oregon, we're at 338,000 cases, 560 deaths, and the cases are high. And they're high for a lot of reasons. They're high because there's college outbreaks, there's workplace outbreaks, there's outbreaks they can't actually pin down, and places that previously had not had a lot of cases, like Lane, Clatsop counties, have now started to have a lot of cases. Marion County, which has always been high, continues to be high. And Malheur County, out where Ontario is, continues to be high. Now, Douglas County, you'll remember in August, was quite low. 3 cases, 8 cases a week. And now we've had 27 cases over the last week. And this is especially concerning because they're not all from one area. They come from 9 separate outbreaks. So 9 outbreaks out there, all growing, that we're all trying to follow. Where they come from, not at all a mystery to anyone who's been watching this over the years. Many of them come from travel. Shocking. People go somewhere else, get sick, come back, spread it for a few days, then find out they're sick, get tested, and then we go back. So again, you've heard this before, but we've added more states. Alaska, Washington, California, Arizona, Nevada, Idaho, Wyoming, Michigan, Louisiana, Florida, Texas, and then probably another one from Texas today, Ohio, Tennessee, Massachusetts, Virginia, and Montana. I mean, this is a story we hear again and again, and the people are like so apologetic. Oh, I'm so sorry this happened. The answer is yes, we get it that you're sorry, but now you've infected all these other people. If you do have to travel to one of those places, please, please, please quarantine when you get back. And gatherings. Again, many of these areas are related to weddings and other kinds of gatherings, so be incredibly careful. So we're going to get some questions. So I'm sure we're going to get a couple of questions about the president. So as everybody heard, the president and the first lady both tested positive for COVID. For people who have been following the news this afternoon, the president was brought to Walter Reed Hospital in Bethesda for some treatment. So I know a lot about Bethesda. When I got done with my training in Boston, my first duty station in the Navy was at the Naval Hospital in Bethesda. And so it's this great old hospital, and I was there during the time that President Reagan was there for his cancer surgery. And so it's the president's hospital. Now, over the last few years, Walter Reed, which used to be in another part of DC, got moved out of there, and they've all got moved to this campus. It really is a beautiful campus, and if you ever go to DC, it would be worthwhile going to. It's about 10 miles outside of DC, and on the campus is the Naval Hospital, is Walter Reed Hospital, which now takes care of both the Navy and the Army. Really a incredible state-of-the-art facility. Right across the street is the National Institutes of Health. So if you're looking for sort of medical might, that area there is great. I'm proud to say my son works at the NIH across the street, although has nothing to do with COVID. So the president got admitted, and the president got treated with several different treatments. He's getting some zinc, and may or may not help. He is getting some Pepsid. Now, you remember, if you were careful watchers, about 5 months ago, there was this observational study that suggested that Pepsid, otherwise known as famotidine, may have had a positive effect. People noticed in China that poor people who were on famotidine did better than rich people who were on one of the proton pump inhibitors for heartburn that many of us have. And so there's been this suggestion that Pepsid or famotidine might decrease mortality. They've tried to study it since, and I have been looking like crazy to find if we can find any more data on Pepsid. I've not been able to find any. The experimental treatment that the president is getting is this polyclonal antibody. So we have talked about monoclonal and polyclonal antibodies. There's just a little difference. But basically, these are antibodies that were developed in a human. They are active against the surface protein. They then, in the laboratory, multiply these so that now you have lots of these, concentrate them into a shot, and then give you in the shot. And the hope being that if you get the antibodies early on in the disease, that it will help your body to fight it off. There is a study looking at these in high-risk people in nursing homes. And they find that it probably decreases the number of people who wind up in the hospital. Well, he's already in the hospital, so it's not exactly sure how it's going to work, but you can be sure that if there's anything out there that even has a glimmer of hope, the president should and will get it. So we're hoping. Now, when you look at the president, he's got some risks. He's 74 years old. That's bad. Now, and the good news is he's in generally good health, although he presumably has some cardiovascular disease. When he had his last year's physical, he had a high calcium score, so he's got some cardiovascular disease. And he, in the past, had been reported to be taking a statin, so presumably has a high cholesterol. He's also, looking at his last physical, obese, so a 74-year-old male, non-smoker, no history of lung disease, and a couple of underlying conditions. He probably has a relatively high rate of hospitalization and probably somewhere between a 3 and 10% risk of death. So this is serious. In our data, when we look at people who are 70 and above, half of them got admitted to the hospital. So the fact that he's in hospital is not the least bit shocking. And when you look at the deaths in Oregon, again, people over 70 tend to make up the most of the deaths. So he's in a tough place, so we should all be thinking and praying for our president. So Desiree says, did the VA outbreak include cases from earlier this year? No, these are separate outbreaks. And so an outbreak at a facility continues until you have 28 days without a new case. And so they've had outbreaks in the past that have quieted. This is a new outbreak. Now, we don't think this outbreak really involves patients. This involves staff. And like most outbreaks, the one at Mercy, the one at the VA, they really don't really affect patients. Basically, what happens is you have a place with a lot of workers. They come in, one person is sick, and then they spread it to other workers. We have not seen in Oregon much spread from patients to doctors or much spread from staff to patients. Really, it appears to be among staff members, and that's not shocking, right? So you're in with the patient, you're very good about using PPE, but then it's lunchtime and you go down to the break room with your buddy and you talk about football and you may take down your mask because you're eating. That's where you'd expect things to spread. But these are separate outbreaks. So Melinda says, I'm traveling to California with my elderly father. Are there safety tips? Well, the first safety tip is really think, do you really have to go? You're leaving one of the safest places in the country to one of the states with the highest level of disease. So the first question is, do you really have to go? If you really have to go, then I would have you quarantine as much as possible before the trip, during the trip, and after the trip. If you're going down there to go to his 80th birthday party, really think about that again. But again, quarantine works in every state, so you just need to quarantine, avoid gatherings, avoid times with other people. So Veronica says, how many cases locally before we can't open K3? So the metrics are incredibly complicated to have you read those, but basically when the rate gets above and stays above 30 cases per 100,000 per week, then schools need to close. And so we have about 112,000 people in the county. So if we got above 33 cases in a week for 2 weeks, then they would need to close. When I looked 12 minutes ago, it was 27 over the last week. So we're not quite at the 33, but we're getting close. And that's why we pray that people will be careful. One of the most important things in our country is third graders who can read appropriately. When you look at all the measures, a future college thing, it's how well you're reading in third grade. And so if kids missed a half of last year and then some of this year, we really want to keep our cases down so our kids can remain in school. So Joanne says, how will we make progress if people won't wear masks? Well, hopefully this thing with the president will be an incredible wake-up call for wearing masks. I mean, he wasn't wearing masks, and he sort of poo-pooed the use of masks and actually criticized Biden for wearing a mask all the time. Hopefully this will get people to remember that they should. So not only the president and the president and the first lady sick, Hope Hicks, who's one of the advisors, is, and just today now there are a bunch of people who were at the Saturday announcement for the Supreme Court justice who are also sick. So, that's going to be terrible because once this gets spread in an area, be it Douglas County or the White House, it's really hard to get rid of. And if you've ever been there, there are some of these people in Congress who are like 200 years old. They're going to be at incredible risk. I mean, if you look at so many of these people in Congress are above 70, it's going to be a huge problem. So Diana says, what is going to stop this pandemic? A vaccine? What are we going to do? So there was a talk yesterday that I was part of on Oregon Health Forum that was repeated today on KLCC at noon, and it had exactly this: how is this going to stop this pandemic? I don't think they answered it particularly well, but let me tell you, I think the vaccine is clearly going to be a help. So once we get a vaccine, we can get a vaccine out to enough people. We can increase the number of people who will have immunity. That will really help. The second thing that will really help is that as more people get the disease, they will likely have some immunity too. Now in Oregon, that's only 2 or 3% of the people, so it's not very many. You're going to need a lot more to do it. The third thing is going to happen, I think this thing with the president is going to make people realize, crap, it really does occur. And yes, masks really do help. Maybe we should do it. So if everybody started wearing masks, that would help. The third, though, the fourth is that people really have to start getting serious about these gatherings. I went to a restaurant last night, really socially distanced, had my mask on all the time except when I was eating 10 feet away from other people, so I should have been safe. But there was this party next to me of people, 40s, 50s, and 60s. There were 15 at the table. They were seated cheek to jowl. They were laughing, singing, doing all those things together. That kind of activity, if any of those people have the disease, they're going to spread. They have a high likelihood of spreading to all the other 15. We really have to get rid of those gatherings. Those are the social gatherings that spread this disease. So that'll help. The other thing that will help is we get better testing. Right on the horizon, I think, are some of these rapid antigen tests, which will really help us to get some rapid answers for people who are mildly ill. Right now, rapid antigen tests are very limited, but in the next few weeks, they should really increase. That will tremendously help. And then I think we as a country have to put our priorities straight. What are our priorities? Are our priorities the economy? Are our priorities third graders? Are our priorities bars? And you have to decide which is which. And then we as a country need to figure out and get this together. And I just hope we do it. And I will tell you, in other countries, they kind of have it figured out. Australia, New Zealand, Taiwan, South Korea, Canada, I mean, they've kind of got it figured out. They have low rates of disease. They've been able to keep the rates of disease low, and at the same time have a reasonable economic recovery. So we really need to do something. Yeah. So what can we do if places don't enforce mask wearing anymore? Well, I mean, you can vote with your pocketbook and just not go to those places. There are a couple places in town that are excellent about wearing masks. There's one grocery store I shop in, and they'll know which one it is almost every night. And they're excellent. I almost never see somebody in there without wearing a mask, and that's why I continue to shop there. So you can do it that way. You know, it's politically sensitive to ask people to wear a mask. I don't usually do that because I'm really not looking, when I'm not at work, I'm not really looking to get into a fight. But, you know, this is going to be an issue. But wearing masks is clearly going to be an issue. Yeah. So this is about somebody who has a premature grandson coming home in the next 4 weeks. Could I watch my kindergarten grandchild and then go see the baby? I mean, you can do whatever you want. There's no rules or laws about things. I mean, we do think that the more contacts you have with the more people, the more likely you are to get the disease. So when people talk about the president, they say, oh, this is karma or whatever. I don't really believe it's karma. I really think that this is like, I drive 100 miles an hour without my seatbelt when I'm drowsy. You're going to get it, sooner or later, you're going to get into a wreck. On the other hand, if you're a very careful driver and wear your seatbelt and follow all the rules of the road, the chance that you could still get into a wreck, but the chance is a lot less. And again, every time you have a contact with a new individual, you're increasing your risk for getting the disease and then passing it on. So I've been incredibly careful. And, you know, I was at a place the other day and somebody had their mask down and they wanted to talk to me, and I kept doing the backing off thing here because I really don't want to get sick, and I really don't want to get anybody else sick. So limiting things. I mean, if the only people you saw was the premature grandson and the kindergartner, that would be relatively lower risk. But again, that kindergartner is presumably, if they're going to school, exposed to 20 other kindergartners. And so the risk is high that it could be there. So outbreaks in large employers, any large employers, be it the VA, be it Roseburg Forest Products, be it at Mercy, is complicated, right? And it's complicated because when you have an outbreak at a facility, it doesn't necessarily mean that the outbreak is happening at the facility. It means that you have a number of people working in the same location who have the disease. And when there's a lot of disease and you're a big employer, it's going to happen. So, you know, if we're talking about 25 cases in a week, it means that 1 in 4,000 people in Douglas County got the disease. So if you had 20,000 employees, you would have 5 cases just because you had, you know, just randomly. Now, these outbreaks at Mercy and at there are probably more than random, but they're not related to bad things that they're doing at either of these places. And yes, every place who's had an outbreak has objected. I don't think we've had one yet where the people said, great, put my name in the newspaper as having an outbreak. And again, should we even be reporting these at all? And it's a balance to play. There are some people who suggest that anytime there's even one case in a facility, you should report it. Other people say we shouldn't report them at all, and you had to draw the line somewhere in between. So again, I'll go back to my Navy days. I didn't realize it wasn't a debating society. So when I went to officers training school, they would talk about your hair and it had to be a certain length. And I'd argue like, well, how'd you come up with 3/8 of an inch? How come you didn't pick a quarter or an inch or whatever? Is there any data that 3/4? And finally, after a few weeks of it, they said, Bob, this is not a debating society. You have to draw a line somewhere. And this is where we've drawn the line. And OHA drew the line when there was a workplace outbreak that had 5 people in it. It's not the right answer, but it is a reasonable answer. And yes, every place that has an outbreak will object to it. But again, it's a reasonable way to do it. So Patty says, will you please address why it's so important to get an influenza vaccine this year? And I will, because many of the symptoms of influenza, fever and cough and malaise, are exactly the kind of symptoms that you see with COVID. And it's going to be really hard if we have a lot of people running around with COVID and a lot of people running around with flu and some people running around with both. We can't do anything the COVID vaccine is not going to be out in time for October, November, but the flu vaccine is out already. So please, 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 please get this vaccine. There are multiple places to get it. Many of the doctor's offices have it. Many of the pharmacies have it. And you can just walk in to the pharmacies and get it, call your doctor and you can get it there. And we're having 3 drive-through flu clinics. These are drive-through flu clinics which will be very safe because you're going to stay in your car. They're going to be very cheap, called free. They're going to be very convenient. They're right here at the fairgrounds. And they're going to be delivered by people who are going to be cheerful when they do it. So it is like a win-win-win situation. So they're going to be on October the 16th at, we'll find the time, October the 16th, October the 30th, and then on November 11th, which is Veterans Day. So Veterans Day is going to have a reverse parade this year at the fairgrounds. And when they have the reverse parade at the fairgrounds, they're also going to have a drive-through flu clinic underneath the fairgrounds. So again, all of these are going to be great because it's going to be free, it's going to be safe, and I can't imagine anything more convenient than driving through. So it's going to be really, really important. So please get a flu vaccine. It would be so great if flu did not circulate. So 10 to 2 for each of the clinics. Okay, so is it safe for kids to play in the park? So again, we do not think you pick up much of this disease outside first, and we don't think you pick it up from inanimate objects like playgrounds and whatever else. You do, however, pick it up from other kids who are squealing and laughing. So if there's, if your kid's there and they're kind of there just with family members, the risk is low. If they're a risk with 13 others who are licking on the same ladder, that's probably a risk. So again, distance, hand washing, being outside, all things make you safer, and you should be safer. So Clarice says, is it relatively safe to go spend a couple of nights at a beach hotel? And the answer was, depends on how you do it. So again, if you go to the hotel and hang out at the bar and then go to the morning breakfast with a bunch of interesting people from around the world, which is typically what I do when I go to a hotel, right? I love meeting people from around the world and how do they find Bandon and whatever. That's not very safe. However, if you make it online, make the thing online so you don't have a lot of dealing there. When you get there, have a quick thing at the front desk, go to your beach hotel, stay in your room, either order in or go get takeout. Then in the morning when it's so gorgeous at the beach, go on the beach, 6 feet of separation from people around you. That is about as safe as you can get and about as beautiful as you can get. I mean, we live in Oregon. We have the world's best coast in the whole world. So please do something like that. But the things that would be dangerous, hanging out at the bar the night before, going to the breakfast, big group photo with 32 people, those are the kind of things that are dangerous. But again, limit exposures, get takeout or eat in the room. When you go on the beach, 6 feet apart, you should be pretty safe. I heard that people who had the flu shot last year had the worst cases of COVID. Is that true? No. So one of the things they did find is that people who had the flu shot were generally more likely to people who get severe COVID. Well, not shockingly, there are very few 33-year-olds who run out to get a flu shot. There are a lot of 70 and 80-year-olds who do. 33-year-olds didn't get very sick with COVID. 70 and 80-year-olds do. This is an example of really, really skewing the data. And I saw this, and shame on the person who put that here. I saw a bunch of things today with President Trump. He's got a 99.9% chance of surviving this. Really not. Overall, if you take the general population who's not infected with COVID, yes, only 1 in 1,000 people is going to die of COVID this year, right? We've had 330 million people. We're going to have, by the end of the year, sadly, probably 330,000 deaths, which means that 1 in 1,000 person is going to die of COVID. However, that's taking everyone who doesn't have COVID and does have COVID. We're taking now a subgroup, 74-year-olds, a subgroup, people have COVID, a subgroup, people are sick enough to get admitted to the hospital. His chance of dying is not 1 in 1,000. His chance is, sadly, higher than that. So again, this was really objectionable. People who do this really should come and argue with me, because I'd love to argue about it. Okay. So Linda says, can you tell the difference between 2 different types of flu vaccines? Oh, I wish there was only 2. There's like 6 different flu vaccines out there. And the biggest difference is the regular dose and the high dose. So we know that older people, 65 and older, which is going to be me pretty soon, don't make as good reaction to the flu vaccine as do younger people. Kids make actually a great response to the flu vaccine. So they have this high dose flu vaccine for seniors that has a higher amount of antigen in it. And because there's a higher amount of antigen, you have more local reaction, sore arm and whatever else, and you tend to have a better immune response. The people look at this, say, yeah, if seniors want to get the high dose, that's great, but the most important vaccine is the one that's in your arm rather than the one that's in the refrigerator. So what I tell people, if you're 65 and above and want to get the high dose vaccine, that's great. Talk to your doctor about it. During the drive-in clinic, we're going to use the single regular dose, which is still effective. Maybe the high dose a little more effective. So if you want the high dose, go to the pharmacy or doctor to get it. For everyone else, come to the drive-in. Okay, let's talk about a few other things. So one of the things that came out this week is a thing called the K factor. So one of the things that's been remarkable about this disease, and we've talked about it a lot, is that some people spread this to lots of people, and then some people don't seem to spread it to anyone. And that's weird, because when you look at something like the flu, most people spread it to their spouse and their kids, or the kids to their parents, and then one other person. But they tend not to spread it to like the whole class. So it's pretty unusual when a kid goes to class that everybody in the class is going to get the flu, or one person at a choir practice with the flu to give it to everybody else. So we're seeing with this disease, not only do some people not give it to anybody else, but then there are a couple of people who give it to lots of people. And so what's called the dispersion factor, which is what's the difference between the least infected and the most infected people in this disease, is the biggest K of any disease we've had. Now, this is not shocking, because with SARS, which was SARS-CoV-1, which was the SARS thing back in the early 2000s, again, what they noticed was some people didn't give it to very many people, and then some people gave it to a lot. And the people give it to a lot are called super spreaders. And when we've looked at those, the super spreaders probably account for about 80% of the cases. And looking at all the stuff that's happening in Washington, I don't know for sure, but now so many people who attended the Supreme Court thing on Saturday are now sick, suggests that that was a super spreader event. And super spreader events, again, is a risk factor. You have to have the right person, and they call it the right person, but it's really the wrong person. The wrong person at the wrong place at the wrong time. So if the person who's going to be the super spreader, and there's nothing that distinguishes super spreaders from the general population. They're young, they're old, not very many kids in this, but they can be, they can be teens, they can be in their 20s, they can be in their 50s. We've not seen anybody in their 80s be a super spreader, but they can be pretty much all age groups. They can be male, they can be female, they can be pretty sick, they can be not very sick. And so there's no way to do it, and we just don't know why there's some people who just tend to spread a lot, but they tend to be the wrong person in the wrong place at the wrong time doing the wrong thing. So the wrong person is somebody who happens to spread a lot. The wrong place is with a group of lots of other people. The wrong time is right at the very beginning or a little bit before your symptoms come out. The wrong place, and then doing the wrong things, which is doing this without wearing a mask. Because you could be a super spreader, but if you limited your contacts and wore a mask, you would be a super spreader who didn't spread to very many people. But imagine if there's a person at a crowded rally, a person at a wedding who is a super spreader. They are the wrong person because they're a super spreader. Of course, they don't know that. They're at the wrong place, a crowded place, at the wrong time, right before they have symptoms, and they're doing the wrong things, which is, I'm at a wedding, so I'm not wearing a mask. And so what we need to do is, what this article called for this week about the K factor, is we need to decrease the number of super spreader events. And you can actually predict what the likelihood that something you're going to do is a super spreader event. So me having dinner with my wife, 1 in 10,000 that this is going to be a super spreader event. Because for that to be a super spreader event would be pretty unlikely because we're never around enough people to super spread. However, this party I was talking about at the bar the other day had all the hallmarks of a super spreader event. A lot of people, so the chance that any one of them was super spreader is additive. Wrong place, inside, doing the wrong stuff, lots of laughing and screaming and whatever, and not wearing a masks. So they were really doing all those things. So if one of the people was there, there's probably a 1 or 2% chance of that being a super spreader event. Now let's get bigger. Let's get a basketball game. An NCAA basketball game, which we've talked about in the beginning as being the highest risk. Lots of chances for those 15,000 people in the stands for one or more of them to be super spreaders. At the wrong place, a crowded basketball game at the wrong time, when you get that many people, there's almost guaranteed that there's going to be somebody who's brewing the disease, doing the wrong thing, standing there and cheering. And the chance that something like that would be a super spreader event is probably 3 or 4%. Still not 100%, but pretty high. Well, the fact that there's so many of these ball games going on every night, that it's almost guaranteed that some of these would be super spreader events. So let's watch out for that. Okay. All right. So people keep saying that COVID is no worse than the flu. They are totally, absolutely mistaken. It is 20 times worse than the flu. So now, are there people who will die of the flu and people with COVID who will be asymptomatic? Of course. But overall, COVID is 20 times worse than the flu. We have never had a president admitted to the hospital for the flu. When you look at people who die and have flu on their death certificate, it's about 10 to 12,000 a year at the worst. We've had 200,000 people die of the flu. Flu is the 20 times worse. So flu is less serious than COVID. COVID is 20 times worse than the flu. Can I explain how they're different? Well, they're different because, again, flu tends not to have super spreader events. The second is that flu has a much lower mortality rate. Even the worst of flus only have a 1 in 1,000 infection fatality rate. This one has at least a 6 in 1,000 infection fatality rate and a much higher infection fatality rate in older people. So it's just worse. And so anybody who says that, please have them contact me with a message, and I will argue this one to the end. They have nothing to stand on. Yeah. Are there tips you can give those of us who absolutely cannot wear a face covering due to trauma? Yeah, I would try. I have modeled a few really distant face shields, and I think if you want to, there are a couple of things you can try. There are people who just can't wear a mask, and I get that, but I think some of these other face shields might work for people. It's going to be hard, right? It's going to be hard because people are going to be really down on you and getting that. So I don't have a great idea, but I've got a bunch of different face shields that you could try that might be much less restrictive. Okay, so Gary says, why are presumptive cases counted even if they test negative? And the reason they're counted even if they test negative because they're still far more likely to have the disease than not. So to get counted as a presumptive, you have to be a close contact of somebody who has the disease, a confirmed case. So you have to be a close contact of a confirmed case. So that puts you in a fairly select group. And then you have to have one of 5 symptoms. You have to have a chest x-ray that shows pneumonia. You have a loss of sense of smell or taste. You have to have fever, cough, or shortness of breath. You have 2 of those. Okay. So let me ask people in the audience here, how many days and you have to get it at the right time, so you have to get it in the right incubation period. So how many days in your life have you had those symptoms? My answer is 0 days in my life that I've had those symptoms. But for most people, it's not more than 1 or 2 days over the last 10 years. So now you're going to have those symptoms in the right 5-day time frame and be a close contact. You are still overwhelmingly likely to have had the disease. You say, well, but I've got a negative test. Well, the negative tests have a negative predictive value in that case only of about 70%. If you have 2 negative tests, you still are more likely to have it. If you have 3 negative tests, it's close to even. And if you had 4 negative tests, you probably are more likely to not have it than have it. Well, why do we look at presumptive cases and call them presumptive? Because they are more likely to have the disease than not. And again, if you want to argue the statistics, I can be happy to do that. But that's why we count presumptive cases. We do this with every disease. We have presumptives in every disease. Okay, so you come in, and there's a cruise, and I've used this before, a cruise ship with norovirus. We don't test everybody, but everybody who's vomiting their brains out and having diarrhea, we consider they have norovirus. And we don't test everybody on the ship. We test a few to find out which norovirus it is. And then the rest of the cases are presumptive cases. So we do this with every disease so that we have presumptive cases. It's not a big deal. And people really need to get past this. Our presumptives, almost all of our presumptives, except for that group at Mercy, which is a weird group, become positive. So almost every day we have 2 or 3 presumptives. Those 2 or 3 presumptives then get tested over the next few days and they become confirmed. So if you look at our number of presumptives, it goes up and down by the days, but most of those presumptives get confirmed so that, typically our presumptives are have stayed in the low 20s for a very long time. So presumptives is the way we do every other disease. Let's consider the alternative. You would say, my goodness, you have all these symptoms, you tested negative, you don't have a case, why don't you just go back and infect everybody else? We know that those people can be very contagious. In China, what they did was, they had a lot of cases early on, and when they had the case, they tested people on every single day they were there. There were a lot of people who tested negative for day after day after day, and then tested positive. Those people almost certainly had the disease. They had the CT scans that looked like it, and what we showed then was having a negative test, even 2 negative tests, even 3 negative tests, as many of those people did not mean you didn't have the disease. And that's why the use of presumptives is typical for what we do with everything else, only adds a small number to the total number of cases, and is totally logical in this way. So people really have to get past that. So are people in quarantine, including presumptive cases? No. So confirmed and presumptive cases are both in isolation. Contacts, that is people who are not confirmed or presumptive cases, contacts are the ones who are in quarantine. There are about today 27 or so in isolation, another 170 or so in quarantine. Okay, a couple more things. There is this new test out called the Bindex. There's a new test out. It's called Binax now, B-I-N-A-X now. It's a test made by Abbott. It is a quick test. The feds bought somewhere between 100 and 150 million of them. They're cheap, about $5 a piece, and then gave them to the states. So Oregon is going to get about 1 million of these tests and then distribute it in the county. So it's going to be great. because when they finally get here, they're going to be like the strep test. When you go to the doctor, come in with sore throat and say, do you have strep? I don't know, I can't really tell. Let's do a strep test. These tests are pretty accurate, pretty quick, get you a good answer. Similarly, we're going to have one now for COVID. So we think anybody who goes to the doctor with COVID-like symptoms should have a test, and you'll get a pretty good answer within 15 minutes. It's not the test you can use before surgery. It's not the test that you should use before travel. It's not a test we should use to like check everybody at the school, but it is a great test for low-risk symptomatic people. So that's going to be coming out. Okay, a couple more things and then we'll call it a night. Again, we think we've just had so many cases, but really, if Douglas County was the state, we would have far and away the lowest death rate and the lowest case rate of any state. So anytime you look at Douglas County and say, oh God, this looks terrible, we still have the lowest case rate. I mean, when we look at our cases over the last week and compare, we're lower than Jackson, Lane, Lynn, Benton, Marion, Multnomah, Washington, Coos, Clatsop. All of those counties have had more cases per 100,000 than we have. I can't imagine what it's like to be there when you have 60 or 80 or 100 cases per 100,000 in a week, because we're at 27 this week and we're working our toes off. You remember our doppelganger analysis, so I look again those all the day and figure out how many cases they have a day. So again, we feel like we're struggling. We have 3 or 4 cases a day. Twin Falls, 39 cases a day. Summerall Size County, 39 cases per day, average, over the last 14 days. Rapid City, South Dakota, where Pennington is, 45 cases a day. And Georgia at 9 cases a day. So, Georgia at least twice ours, but Pennington and Twin Falls, about 10 times our case rate. Again, if we had 39 or 45 cases in a day, we would just give up. And you know what? They've kind of given up. So when we look at other areas that have a lot of disease, they're calling people and say, hey, you're positive, you should stay home, and leave it at that. Because we have a lot of them, we're able to do what this K factors thing said is to do not only forward contact tracing, who were you in contact with to stop it there, but then also going back and tying our cases to previous cases. So in much of the county, more than 50% of the cases are not tied to another case. Oh, you just got it, I'm not sure. We're able to tie 92% of our cases to a previous case. The people who do this in our group are just amazing. They're like these detectives. So I really like the forensic file shows, and they're dogging and figuring out who did this, and they find one little dog hair and they can figure out, who it is that committed the crime. Our people are incredibly good at sort of figuring out where this disease came from. So we had one this week, a person who was sick and hospitalized and whatever, and where did they get it from? And they traced it back to a livestock show in Nevada. I mean, it was like great tracing it back. And so they're really good, because 2 of the people on our team are really old-time sexually transmitted infection people. And so sexually transmitted infections, you obviously got it from somebody and you could give it to somebody. So, there's always a source of these infections. It's never the toilet bowl. And so you have to go back and find out who gave it to you, because they could have given it to other people, and then who you may have given it to, because they could do it. So our people are really into finding out where this disease came from. And I think that's some of the reason we've had success, is because we have been able to track it down. If we had 45 cases a day, there'd be no way to have enough time or expertise to do it. And the other thing that would happen at 45 cases a day, there'd be a lot of overlapping contacts. So again, it's been a bad week for us, but we're still doing okay. K3 can still be open, but still be really safe. Be really careful about travel, especially when you get back. Be really cautious about gatherings. And if you do get sick, please get tested. Again, our thoughts are really with the President and the First Lady during this time. And, having to be hospitalized for COVID is bad. When we look at people who have COVID, a recent study that came out looking at people who had COVID were moderately sick, probably less sick than the President. 2 months later, 85% were still sick. When we checked our people who had the disease in March and April, 80% were still sick 6 months later. Sick. I mean, sick like I'm not back to normal. I'm not able to do my regular activities. I'm short of breath, I have chest pain, I have brain fog, all of those kind of things that really make life miserable 6 months later. So it's a pretty bad disease. Now, again, that's another difference with the flu. Talk to people who've had the flu, and again, I've had it a few times. I'm in a high-risk situation, right? I'm around kids who scream in my face. I'm seeing lots of sick kids, and I get the flu shot. There were 3 years the flu shot didn't work, and every single one of those times, I absolutely, positively remember getting the flu. I almost never get sick, but when I got those, it was miserable. So one time when I was in medical school, one time in 2015, and then one time when I was in the Navy, just absolutely miserable. So, but in 10 days, I was back to good. Almost no one is back to good 10 days after having COVID. Many of these people are sick, still quite sick, weeks and months later. Okay. All right, any questions? All right, so again, stay safe and be kind. I mean, there's a bunch of things going out there today that I saw on Facebook, which really were uncalled for. You know, like it couldn't happen to a nicer guy or whatever. Guys, you know, this is the time to pull together. This is the time to stop with negative ads on TV. This is the time to pull together as a country and be sure that things are good. We've not had a president in the hospital for serious illness since I was in the Navy, and Ronald Reagan was in the hospital first during the assassination attempt, and then again when he had his colon cancer. So it's been a long time since we've had a president in the hospital with a serious illness. Time for the country come together. Please be kind, be safe.